Welcome everyone to today's webinar, Socially Connected Communities, Solutions for Social Isolation. We hope this webinar finds you safe, well, and having an enjoyable summer. We begin today by acknowledging that we are meeting today on Indigenous land. For those of us who are settlers, we recognize the contributions and historic importance of Indigenous peoples and affirm our collective commitment to make the promise and challenge of truth and reconciliation real in our communities. We invite you to share where you are joining in from today in the chat box. We hope that we have many people joining us from across the country and beyond. So let's get started. Social isolation has no doubt been exacerbated in the midst of an ongoing pandemic. Never before has addressing issues of social isolation been more relevant and needed. But what framework is necessary to enable more socially connected communities where all citizens can thrive? Today, we are pleased to have two thought leaders joining us to discuss systemic drivers of social isolation and community-level recommendations for action. Today, we have with us Risa Wilkerson. She's the Executive Director of Healthy Places by Design. Healthy Places by Design advances community-led action and proven place-based strategies to ensure health and well-being for all. Amanda O'Rourke is the Executive Director of 880 Cities. The organization brings cities together to enhance mobility and public space in order to co-create more vibrant, healthy, and equitable communities. Welcome to you both, and we're going to hand it over to you, Risa.
Thank you, Elle. I appreciate being here. I'm so looking forward to this conversation with all of you. So you may be wondering who we are. Healthy Places by Design is an organization that partners with health-focused funders and others to provide technical assistance to community leaders and coalitions and coordinate collaborative learning networks. We do this with local and state groups that are working to advance equity and health, and you can learn more about us at our website. So we're here to talk about socially connected communities. Why? Well, we know that leaders who strive to create resilient, equitable, and healthy communities often focus on physical and mental well-being. This is critically important, of course, and we do this by addressing conditions that impact the quality, safety, and affordability of housing, healthcare, education, food, recreation, transportation, jobs, clean air, water, and more. However, social connections are often overlooked despite their vital contribution to health and well-being. It is a part of social well-being, which is the strength of a person's relationships and social networks. And it's strongly linked to social inclusion and a sense of belonging. People living in socially connected communities are more likely to thrive because they feel safe and welcome, and they trust each other and their governments. Trusting, meaningful relationships enhance our mental, physical, and emotional health and well-being. In fact, as you can see on the screen, strong social connections and networks can boost a person's lifespan by 50%. People often talk about social isolation and loneliness as if they are two of the same thing. They're not. They're related, but they're not the same. Socially isolated people lack significant social connections interpersonally and within their community. You can feel lonely, but still have lots of social connections. And many of us have experienced that in this last year and a half or 6 years of the pandemic, whatever it's been. Loneliness can be a symptom of social isolation, but it's not always. The conflation of these terms is linked to how isolation is being defined, discussed, and addressed primarily through an individual lens, rather than a systemic one. So consider the terms hermits or loners as ways that we describe socially isolated people, as if it's a consequence of choice or failure or trait. And I think that helps to make the difference and help to see what we're talking about here. Who is experiencing social isolation? The rates of social isolation are soaring globally, and they have profound impacts on health and well-being. When we wonder who it is, we know we need some better metrics or better data, but our current metrics indicate that people of all ages, demographics, and identities experience isolation. In 2004, a quarter of US adults had 0 people in their network with whom they could discuss important matters. Imagine that. In 1985, that figure was 10%. In a 2018 study, more than half of adults had 1 or fewer confidants. And this was well before the pandemic shuttered our gathering places and created even more barriers to connecting with each other. Various life experiences exacerbate social isolation. So if you're on the call today with me, please close your eyes. I'd like everyone to just listen for a moment to these life experiences and imagine people in your life. Think about if you know anyone who has experienced any of these circumstances in the past year or 2. Long-term illness or disability, domestic violence, loss of a loved one, becoming a caregiver, having a baby, moving to a new place, migration, being rejected by family members for your identity, incarceration, homelessness, immigrants, people living in rural areas, and individuals and families struggling to make ends meet. You can open your eyes. If we were in a room together, I'd ask you to raise your hand if you know people who have been in these circumstances, and I imagine most hands would raise. We see then that social isolation is widespread. Why is this so important? It is a public health crisis, and this is why. The health risks associated with social isolation are tremendous. It's equivalent to smoking 15 cigarettes a day or having alcohol use disorder. It's twice as harmful to our physical and mental health as obesity. It's linked to depression, poor sleep quality, accelerated cognitive decline, impaired immunity, increases in suicidal ideation or attempts, increased risk of stroke and coronary heart disease, and frankly, just increases the overall risk of premature mortality. So social isolation is not a personal choice or an individual problem. It is rather one that is rooted in community design, social norms, and systemic injustices. These are just a few of the systems that we have inadvertently or otherwise designed in a way that leads to isolation and oppression. Let me share some examples from just 3 systems that correlate to the recommendations we have in our report. First, public spaces. We have designed buildings and public spaces that are often inaccessible for people with disabilities, making their participation in public life difficult or impossible. Some public spaces display historical symbols or artwork, which favors certain races and worldviews while omitting or offending others. Systemic racism and oppression can make it unsafe for BIPOC, LGBTQ, immigrants, and others to safely gather with friends and family. Housing is another area that has been designed in a way that creates isolation. Public policies such as redlining have created racially segregated neighborhoods where discriminatory lending and other practices have stymied home values. This isolates minority students in poverty-concentrated schools and produces extreme wealth disparities. And here in the US, there are laws like anti-loitering laws that effectively make homelessness and poverty a crime, resulting in the forced removal of people from public spaces. So you're seeing how these are beginning to interconnect. And thirdly, in transportation, we have developed a transportation network that again splits people apart. The history of highway development in the US specifically has split communities of color, resulting in a legacy of severed social networks and polluted neighborhoods. Travel by anything other than car, in other words, bicycles or buses, is often stigmatized, and related investments often bypass low-income communities, which would benefit the most. Our pedestrian fatality rates are also disproportionately racialized. I'd like to pause here and turn to Amanda and ask you now to jump in Amanda is a much respected colleague and also was part of the writing advisory group that developed this report. Amanda, what have you learned from the communities you work with about the structural drivers of social isolation?
Thanks, Risa, and pleasure to be here with everyone today. Thank you for that very broad introduction too, and I'll just build on some of the things that you already said. One, I think that I've learned that we have to recognize that the growing crisis of social isolation over the last few decades is not because people like socializing less. There's been no fundamental change in the human condition. And it's really because we've created environments and conditions that are isolating. So people are social creatures. We thrive with sociability. It has, as you said, impacts on how we function. It impacts our brain chemistry, our stress levels, our mood. It's physiological, it's mental, it's emotional. It affects our health and well-being in so many ways, as you said. And so the growing challenge of social isolation isn't just something that happens or that is inevitable, like an inevitable aspect of our modern society. We are literally reaping what we sow, and what we have sowed are unjust, inequitable systems, those structural drivers that you're talking about. So to answer your question on structural drivers, those wider set of systems and forces shaping the conditions of daily life, I think many folks would really know them as the social determinants of health that have been long studied and talked about. And you talked about it in your opening. So access to safe housing, transportation, and the quality of your neighborhood environment, that impacts your daily conditions of life. Racism, discrimination, and violence, that forces the conditions of your daily life. Access to education, safe work, your income, it shapes the conditions of your daily life. Access to nutritious foods, your opportunities for physical activity, it shapes your conditions of daily life. Whether you have access to fresh air or clean water, that shapes the conditions of your daily life. So these are all really important aspects to think about when you're talking about social isolation, and that I've learned not from the work that we did with the Robert Wood Johnson Foundation on our addressing social isolation in winter, but also from the network. And I'll just say that one of the fellow researchers and colleagues in that network, who you know, Risa, came up with a term that I think really demonstrates what we're talking about very well. So Yolanda Ogbolu, who you know from the University of Maryland School of Nursing, she coined the term situational isolation. So it's really to describe the self-isolating behavior that makes it difficult to get out and develop social connections. It's not a choice, it's but the circumstances and the environment and the social setting that people are around. So I'm going to just share like 2 or 3 examples very quickly about how that showed up in our work on addressing social isolation in winter. So when we spoke to older adults in all of our 3 cities that we were working on addressing social isolation in winter, we heard from older adults that the lack of clearing of snow and sidewalks and fears of falling meant that they would not leave their homes for months at a time. Or families with young children who were pushing strollers and needed to rely on public transit told us that it severely limited their ability to move around their community and do the basics of daily life. When we spoke to members of the Latinx community in the town of Leadville, Colorado, they said that winter wasn't the reason that they were not participating in public life outdoors. It was because of fear of ICE raids and police. When we spoke to folks in underserved neighborhoods in Buffalo, New York, about getting outside, using the parks in wintertime, they said there was nothing to do in the parks that were the neighborhood parks, and that all the good winter programs were downtown and were too far away. So those are just a few examples of how that situational isolation shows up in communities.
Thank you so much, Amanda. Those are powerful examples. And yes, I absolutely remember Yolanda talking about situational isolation and, people feeling trapped in their homes for the condition of their neighborhoods. And then many of the other examples you shared as well have been enlightening as we have continued this conversation. So thank you for sharing those. We'll come back to some more examples from you in a moment. And then I will continue on. Maybe. Yes. All right. So during 2020, there was a social isolation learning network made up of leaders serving diverse populations in equally diverse settings. Amanda was a part of that group as well. And together, through our conversations, we realized some many truths about what needed to be shared and could happen in communities to really address social isolation. So we co-created a set of resources, which is a report, the cover that you see on the left of the report, and 2 action guides to help reframe the national conversation or international conversation now. The report seeks to inspire, equip grant-making organizations and local leaders to intentionally redesign community-level systems in order to support meaningful social connections and to prioritize social well-being in health and resiliency work. We all came up with some guiding concepts for the report, including asset-based approaches, equity and inclusion, and cultural and historic context. Those are woven, they're described in the early part of the report and woven throughout. We also created 5 recommendations, as you can see on the screen, as starting points for addressing social isolation. This is not the encyclopedia by any means. It is intended to really spur conversation and action to get started. 3 are focused on the built environment and 2 on norms and inclusive practices. We started with housing, transportation, and public spaces because housing is the center of our lives, an anchor point for our health. And when we step outside of our home, we immediately encounter transportation networks and public spaces. These are the structures that enable access to all other sectors like education, job, healthcare, and more. The last 2 recommendations address community practices and move towards social connectedness as a community norm to support the first 3 and more. So I'll take a brief look with you at each of these recommendations, even though we don't have time to get into them in great detail. It'll give you a little better sense of what we're talking about. So the first is co-creating inclusive, healthy spaces that encourage social interaction. So we're talking about designing safe spaces for all ages together, encouraging intergenerational exchange by, for example, co-locating services for different ages, and then developing policies that decriminalize loitering and enable more innovative use of public and parks and public spaces. So an example would be winter fire pits in parks, as they did in Buffalo, New York. For housing is the second one. We're talking about strengthening and safeguarding inclusive, affordable housing through zoning and other design measures that help residents gather and make social connections. This can include housing first strategies that have wraparound supports. It could mean co-locating parks with affordable housing wherever possible. It might mean mixed income housing to support ways to create diverse community and to reduce the stigma of public housing, or mixed use development to improve access to various services and resources. Our third recommendation is around transportation. So we recommend thinking people first with transportation systems. So we're prioritizing movability through walking and bicycling networks, transit service, lower traffic speeds, air quality control, as well as connecting transportation nodes to the places that people visit most often. We are thinking about creative uses of transportation facilities. So for example, play streets doubling as summer food service sites or little free libraries at bus stops. And finally, also thinking about policy levers that can promote health and equity. One example in the report was called Gender Balanced Budgeting, an example from Sweden, which revealed when they worked on where was snow clearing happening, it revealed practices that disadvantaged women who were more likely to walk. The last two recommendations are not focused on the built environment, but they address the community practices and social connectedness as community norms. So here you see shifting power to community members, elevating practices rooted in culture, thinking about creative communication and broadband access, just as some examples. And then thinking about how do we lift social connectedness or social well-being as an overarching community value or norm. There's a great article in Health Affairs about a social in all policies framework. We also recommend implementing trauma and resilience informed practices, and then really declaring community values. So with that, I would like to come back to you, Amanda, and have you share with us ways in which 880 Cities is working to enhance the public realm and to create vibrant, healthy, and equitable communities.
Thank you again, Risa. I like this back and forth, fun. 880 Cities, for those who don't know, we're a nonprofit organization. We are based in Toronto, but we work internationally. We work all over the world. We bring people together to transform mobility and public space. Our mission is to really improve quality of life for people living in cities, no matter their age, ability, or socioeconomic status. And so for the last 15 years, we've been challenging cities on how they design, plan, and manage their streets and public spaces by asking a simple, but we think powerful question. That is, what if everything we did in our cities was great for an 8-year-old and an 80-year-old? We believe if you start there, you can create a better city for everyone. Why 880? Well, aging is a universal human experience. It is, everyone can kind of relate to a child or an elder, and layered on and deeply connected to how we experience or navigate public space is social identity. Of course, our race, our gender, our ethnicity, our cultural background, our ability, and our social status in terms of income. So our work really centers on bringing people together to transform mobility in space and public space and reclaiming space and the right to the city for everyone, especially for those who have been disproportionately impacted or marginalized by car-centric planning and a disinvestment in public space. As Risa mentioned, so when we design our transportations, thinking about just moving car traffic, it has a really negative impact on children's health, on older adults, inclusion in society and in mobility. It has a disproportionate impact on low-income populations, as well as racialized communities from the historic exclusionary zoning and redlining practices. So we're really trying to correct for some of those past injustices by reclaiming space and reclaiming the right to the city through reclaiming the right to mobility and public space and the right to participate in city building. So when it comes to mobility, you can move on to the next one. We really focus on creating streets where people can actually make eye contact and socialize. So this is a really important part of building social connection and community and inclusion. You know, you can start as simple as eye contact or a place to sit and have a conversation. It's amazing how we've done such a poor job of creating spaces where we don't actually get to make eye contact or connect with others or socialize. It also means, you can go to the next, where we really think about walkability and elevating the pedestrian in communities, because walkability is so important in terms of building not just mobility, but also social connections in public space. So trying to roll out the red carpet, think of the pedestrians as the kings and queens of the streets, whether you're children or older adults or people using mobility devices. the way we design our streets and public spaces has a huge impact on your sense of inclusion in community. You can go to the next one. Streets are actually one of the largest public spaces in our communities. They often make up about 75% of the public space, which is space that belongs to everyone. So when we open up that kind of space to people of all ages and all abilities, like is seen here in this picture with our Open Streets program, you actually can have more diverse participation in society. So here, I love this picture because this program is, this is in Toronto, Canada, but this Open Streets program is modeled on the Ciclovia, which was started in Bogota, Colombia by our founder, Guillermo Peñalosa. And many cities have tried to replicate this, opening streets to people and closing it to cars every Sunday morning when traffic volumes are low, as a way to create more public space for people. Many cities have actually experimented it with this program amidst the pandemic with increased pressures on our parks and public spaces. But this picture reminds me that almost every single year, and in Toronto, we just do 2 program dates. And on those 2 dates, it's not every Sunday, one day it will be. On those dates, we always get these really lovely notes from folks. And the folks who use mobility devices often say, this is the 2 Sundays of my entire year where I feel like I can really experience my city and see my city. And so this reminds us about how important these public spaces are to quality of life. Imagine if you could have that every day, or imagine if we just created streets that were accessible for everyone, the impact on the quality of life for people. The next slide is, so we talked a little bit about right to mobility, and of course, right to mobility is really focused on walking and cycling and access to public transit for everyone. But the right to public space is, we understand that public space plays a really critical role in fostering social inclusion and connection and sense of belonging. The way we design, you can go to the next slide, program and manage our public spaces has a direct impact on who uses the space, who feels welcome in the space. And you can find it, you can actually build social inclusion or activate public spaces in even unconventional spaces. So this is a vacant lot that was transformed into a park for people of all ages. And just think of how much better performance this space is having now that you've added a few chairs and some games for young people where it used to be sitting vacant. So these kinds of small interventions, it doesn't have to be a huge capital investment, but small interventions can actually significantly impact people's experience in public space and their opportunity to meet new people. One of the things we do with these kind of pop-up interventions is we evaluate them by asking people, did you meet anyone new today? And it's really interesting to see the results of those kinds of surveys, and many people do, just by simply adding a bench. You can go to the next slide, Risa. And as Risa mentioned, you know, along the line of not having to be a capital investment or huge expense, sometimes it's as simple as adding a fire pit to get people out into their parks in the wintertime, roasting marshmallows. It's creating those invitations to use the space. And movable chairs are one of the best simple interventions that you can put in a public space to actually encourage conversation. It seems so obvious, but again, take a look at your parks and public spaces in your community and notice how little seating there is for people to actually sit down and have a conversation and build social connection in space. You can go to the next slide, Risa. This is a photo from a friend. It's a little bit fuzzy, the quality's not great, but this is to make the point that this park used to only have benches. And one of the things that we heard from community was that they wanted movable chairs. And one of the community members took this picture with her phone and sent it to me and was like, now we have movable chairs. I get to have my book club every week. And so just think about how a simple thing like chairs and tables has impacted the quality of life for these ladies here coming every week to see each other. Next slide. And it's not just the design of a public space or the infrastructure, but it's programming, activities. So really thinking about activating public spaces in a way that meets the needs of the diversity of the community members. And again, along the same lines, it really does not have to be expensive. This is a activation where we basically took some of the programming that was happening inside. There's like these aerobics classes. We brought out some speakers into the public space and brought it outside. This is a great example of how cities can do more to make it easier for community partners to actually activate the public space by making permitting and the whole process to be involved in and activate the public space easier and more accessible for community members. In this way, the city or municipality can kind of function as more of a facilitator of the activations, and this really builds in broader a broader community spirit and stewardship of this public space. You can go to the next one. And the last right, so we talked about mobility, we talked about the right to public space, and the last one is the right to participate. And we believe that everyone has the right to participate in city building decisions that affect them. And we really focus on prioritizing underrepresented voices in city building. And participating in civic engagement and community building doesn't have to be just attending meetings. It can be actually building and being part of creating a new space, which is a big part of the type of engagement that we do. You can go to the next slide. We know that if people are kind of engaged in more hands-on activities or actually part of the change, they're much more likely to be engaged in the long term. So sometimes those tactical approaches that we facilitate are really great in terms of bringing in new people into the process. At the same time, when we think about right to participate, it's really about meeting people where they are. It may seem super obvious, but if you want to engage people that are traditionally left out of the planning processes, you have to do the work to go to them. It means, for us, it means popping up at transit stations, libraries, community centers, street corners. This picture I love because the story related to this is we were popping up in a transit station in a community in Macon, Georgia, and it was a mobility related project. And we asked people how they got around in Macon, like what did they want to see different? And this gentleman here was like, what are you guys doing? What is this all about? And we told him we wanted to know how he got around his city and what he'd like to see improved. And he said, no one has ever asked me that question ever. So it's interesting that, you know, we often frame it as these sort of, it's really hard to reach communities or underserved communities in the planning process, but we can actually really do the work at the front end, go to where they're at and actually create more space for listening and including their ideas in the planning process. This also takes shape in other kinds of approaches like focus groups. You can go to the next slide. So actually going to where people are already congregating and asking questions. This is a focus group we did with Latinx seniors about their experience with winter. I also love this picture because this was where this lady in the foreground, we had an interpreter speaking Spanish, and we were asking, what do you want to do in the park in wintertime? And the lady said, I want to do more curling and activities outside. And our interpreter was like, you want to do curling? And she was so funny. She said, yeah, I'm not dead yet. I want to go actually be active in the park. You know, it's winter time. I want to actually move my body so I don't get cold. So it's also about like challenging these assumptions that we have about what people want to do in public space. And we'll never know what people want unless we actually go and ask them and do the work. You can go to the next slide. And of course, a lot of our engagement is also not just speaking with older adults or racialized communities or newcomers. It's also really talking to children and seeing what they see, using sort of fun, playful methods to get them engaged in reimagining a public space. Next slide. And children are really honest. I love that. I love that they give it to you really straight. They will tell you exactly what's working and what's not working. We also do a lot of work with community partners and building those really important relationships with community partners. As outsiders, we need to do that work with community partners because they know the community really well. So someone like me, I wouldn't be able to just walk into a community center and talk to youth in a majority Black neighborhood. We work with community partners who know the young people, who have relationships with the young people, who could actually ask them questions about how they experience the public space. You can go to the next slide, Risa. And this is connected to the example that I shared at the beginning. You have to be really, when we're doing community engagement, you have to be willing to really listen to what people are telling you. You might come in with these ideas on activating public space and improving public life, which is what we came into the Wintermission project, which was all about how do we actually encourage people to get outside more in winter. Some of the answers that we received were, winter is the least of my worries. I would love to be able to engage in winter, but there are big structural challenges or big systems in place that really prevent me to feel like safe in public space. So it's really about listening to these big challenges and incorporating that lens in terms of how we approach solutions to social isolation. So, working with the community partner here in Leadville, they had mentioned that they had not had a lot of experience reaching the Latinx community. And so, we popped up in some of the grocery stores where people frequent. And while, this was not like the most robust engagement, it did start to build relationships, and you have to start somewhere. So, we're not saying that this one pop-up like changed the course of the engagement with this vulnerable community, but it does have to start with actually putting the effort in starting those conversations and building those initial relationships. As a result of these engagements popping up in different grocery stores, we actually were able to have a community champion really sit in on the broader work on the winter strategy, which was a big sort of win in terms of including more diverse voices in the planning process for that community. Next slide. And so lastly, I just want to say, and to really bring home the point that I was making earlier and Yolanda's wonderful definition around situational isolation, we have to remember that the way we design our communities, whether it's winter on top of it or not, has a direct impact on our risk of social isolation. And these are really felt differently depending on your social location, your gender, and your lived experience. And what really drives change in community, you can go to the next slide, Risa, is collective action. And what we learned from our project, working with those 3 cities on Wintermission, was that these kind of multi-stakeholder relationships were so needed in moving things and actually initiating change on social isolation. It doesn't happen organically. Our city systems are very much set up to be siloed. So you actually have to create the space for this kind of cross-pollination where community, city partners are coming together. So while the bad news is that you can go to the next slide, that we've created these environments and public spaces that exclude and isolate, the very good news is, you can go to the next slide, is that we can change and create more accessible streets and public spaces. And I want to say that the process of doing so So this is an example where the process of actually engaging people in rebuilding the street, reaching people that had never been engaged in city planning before, is as important as the outcome, or like the infrastructure and design changes that can foster more inclusive environments in the long run. So this is my last slide, and I won't go into detail because Risa's really talked about using that asset and equity-based approach. And it fundamentally comes down to asking what's already working in your community, what are the strengths already in community, recognizing those really important strengths in community, and then also identifying who isn't benefiting and engaging those groups and developing targeted approaches to understand and link those learnings to broader changes in policy. That's it for me. Thanks.
I want to just wrap up, and this is also kind of a what's next. So I would just ask people to imagine a socially connected community where people know and trust their neighbors and people from different neighborhoods, where they're motivated and supported through fair processes and practices to be civically engaged, where structures, policies, and relationships connect residents to important services, resources, and inclusive spaces, and where people see themselves in the design, art, options, and practices represented and feel welcomed in their community. During this important pivotal moment in history, it's really more urgent than ever for local leaders to work with residents to create socially connected communities. So, and this priority can address past and current traumas due to structural and systemic oppression and build more resilient and equitable communities where everyone is able to thrive. How do we get started? There's a report you can share, 2 action guides that are short. It's a great way to get the conversation started. You can host conversations in your community, start implementing any community level solution, small, large, and in between. We've given you many ideas today. And Amanda and I, and I'm sure Tamarack Institute, are more than happy to continue the conversation with you and think through, brainstorm with you what can happen. We'd love to hear your stories, your feedback. And finally, we are just beginning a local leaders learning and action network to describe solutions and ideas around this based on the report. And if you're interested in joining that, please reach out to me and let me know.